Hello, my name is Dr. Fiavi and welcome back again to my channel, Body and Mind Unplugged. The other day we talked about a very common medical problem that affects our women. Well, fibroid, right? Well, today I want us to pay attention to our men. They also have a common medical problem that affects them. This condition is called benign prostatic hyperplasia. Well, it's a mouthful, so let's just call it BPH. What is BPH or benign prostatic hyperplasia? Benign simply means non-cancerous. Hyperplasia means too much growth. So, in simple terms, non-cancerous overgrowth of your prostate. Okay, let's look at it that way. What if I told you that 50% of men between the ages of 51 and 60 who develop BPH or are living with BPH? How about a whopping 90% of men over the age of 80 who develop BPH? So, what causes BPH? First of all, let me talk about the prostate. The prostate is a very small organ, or the prostate gland is a very small organ that is situated underneath the bladder and around the urethra, and it has a very, very important function. Okay, it aids in fertility because it produces the fluid that goes inside the semen. So yeah, it's a very important gland. Unfortunately, when men start getting older or fall within the age group that I mentioned earlier, testosterone levels also drops. And when that happens, it makes the prostate gland gets enlarged. And when it gets enlarged, it pushes down on the bladder and the urethra, which affects effective urine output. I hope I'm making myself clear, right? Okay. So that being said, what are some of the risk factors of BPH? When you have a family history of BPH, when you have medical conditions like diabetes or cardiovascular problems, erectile dysfunction, obesity, lack of exercise, all these things are risk factors of developing BPH. Okay, so when you do have these risk factors, in addition to some signs and symptoms, then it is very, very wise to talk to your healthcare provider. What are some of these symptoms? Urinary agency, frequency, not able to empty your bladder, frequent urinary tract infections. Nobody want to go to bed waking up too frequent to use the restroom because it's ultimately affect the quality of your sleep as well. Okay, so when you're having all these symptoms, dribbling here and there because your urinary tract system is weak, you need to talk to your healthcare provider. Okay, you remember when you were 40 years old and your doctor tells you that you need to come and get your prostate exam. They put on a glove and do that uncomfortable test. Well, we don't do much of that test anymore because now we have a lot of advanced techniques to test for BPH or diagnose or rule out BPH. Okay, urinalysis, PSA testing, urodynamic testing. We have a cystoscopy, ultrasounds, a whole bunch of advanced tools are available to us now to diagnose or rule out BPH. And your healthcare provider may even go a step further by ordering a prostate biopsy to rule out prostate cancer. Okay. And so if you do have BPH, what do you need to do? Cut down on caffeine and alcohol, because these are stimulants that stimulate your bladder. Cut down on those things. Exercise. Take good care of yourself. Bladder training can also help. And then there are some medications that your healthcare provider can prescribe that can help manage this problem as well. There are very common ones like tamsulosin, brand name, Flomax. This medication can relax the muscles in your prostate glands. Okay. There's also another common medication called tadalafil, brand name Cialis. This medication is usually prescribed for erectile dysfunction, but can also help relax the muscles of your urinary tract system. Okay, so sometimes your healthcare provider can, prescribe that as well. And if you're somebody that have BPH and erectile dysfunction, then hey, double whammy, using one stone to kill two birds. Okay. And also, there's a very important medication called finasteride. This medication can help shrink the size of the prostate or even stop the overgrowth of the prostate. Okay. So there's help out there. It's a common knowledge that men usually don't like seeking medical help as much as we women do. So for the women out there, if your partner is having the symptoms, be their biggest support system. Be their biggest support system and encourage them to talk to their healthcare provider so they can seek help. Okay. That being said, don't forget to click subscribe and share so we can continue having these conversations. I'll see you.